Hi, this is Tomasz. My guest on today's podcast is Jezel Rosa, a psychiatric mental health nurse practitioner certified in integrative medicine for mental health. Hello, Giselle. How are you
Hi,
doing?
how are you doing,
Hi,
Tomas?
nice to meet you. Could you share a bit more about yourself? What do you do, and what does your work with clients look like? How exactly do you help them?
Well, thank you so much for having me, Tomas. And as far as the work that I do is I basically take someone's genetic profile. I have them do a genetic test. I look at their genes and I identify what things are going on that could be potentially impacting their mental health symptoms. And so then once I understand the genes that could potentially be impacting their mental health, for instance, MTHFR, I then want to look at their homocysteine, which is a blood marker. So that's telling me what's going on right now. Your genes are your blueprint, they don't change. And then the labs are the biomarkers that change based off of many factors. So by understanding the labs and then optimizing someone's nutrients can also help their mental health and optimize their brain health and brain function. So I take, different variations of genes. I assess them in groups, and then I identify which nutrients would be best for them based off of what they're showing in their labs they're deficient in. So it's very targeted nutrition and supplementation for optimizing brain health.
Okay. Well, sounds interesting. And do people experiencing withdrawal symptoms from psychiatric medications come to you?
Yeah. So when I first started this journey for in my practice, and then I moved on to coaching, I accidentally injured a patient by taking them off of clonazepam too quickly, and that's how I learned about the Ashton Manual, and I learned about withdrawal and all of these issues. So I was a conventional practitioner, and then I converted to more of a holistic practitioner once I found all of this out. And and so in that, I started dedicating, my practice to helping people, who wanted to come off of medication. Now, if someone is coming to come off of medication or maybe they don't know how, I talk to them about optimizing nutrition first, as long as they're not injured.
Mhm.
Because once you have an injury, your nervous system is very sensitive to changes, including supplementation. So we can try to optimize someone who's injured, like a protracted injury, their nutrition based off the same thing, your genetics, which doesn't change, and then looking at your labs, finding out what's going on. We often find a lot of inflammation and deficiencies, but we have to take it much, much slower approach for those who are protracted,
Okay.
because their nervous system is so sensitive and oftentimes takes a long time to heal regardless of supplementation. So there is no so I never want to falsely advertise that there's like a quick fix for
Yeah.
someone who's protracted and getting them, healed in that sense. It's still a long journey, but I can at least help support you in a way where we can optimize your nutrients. We can see where you're deficient and do it in a careful, slow manner,
Mhm.
to at least give your brain and body what it needs, like the tools that it needs to do the healing. But it's still going to take a while to heal if you're in a protracted injury. If not, and you're just kind of learning about wanting to come off your psychiatric medications, and I advise optimizing your nutrients first,
Okay.
because supporting your brain health first can be very important to allow the taper process to be less risky, because now you have all of the nutrients to support a good taper.
Okay. Makes sense. And what nutrients do you find that people mostly have, like in deficiency, when they are about to taper or in the protracted withdrawal?
So when someone's about to taper, like what I find oftentimes is homocysteine is elevated.
Mhm.
And this is someone who, for example, has been on SSRIs for a long time for depression, and this treatment stops working. Their doctors are telling them, oh, they're treatment resistant, and there's all of these things going on,
Mhm.
and they are feeling stuck. and they say, well, I heard that I want to come off, that I should come off the medication, not be on it. So then they'll find me and we'll have a conversation and we'll talk about labs. And I'll do a panel of labs specifically looking at homocysteine, vitamin B12, which is very important for neurotransmitter function, but also folate or B9, which is just as essential. And then looking at other markers to make sure we're ruling out other issues like thyroid dysfunction, inflammatory markers for depression and things of that nature. But I commonly find homocysteine elevated. And I believe that has to do with, and that's why I've switched to the model I have now, because I used to just look at labs. Now I look at genetics because I found a pattern of people who are on psychotropic medications oftentimes have a genetic issue. MTHFR, COMT, DRD, your dopamine receptor, your COMT is your catecholamine breakdown, MTHFR is how you break down folate. And when you have these as issues, you're going to have mental health symptoms. You're going to feel depressed. You're going to feel anxious. When a doctor then prescribes you an SSRI, you feel better for a short time because it's putting the Band-Aid on it and it's giving you what you need, which is more of the serotonin, but you never fixed why your body was deficient to begin with, why you couldn't produce your own, or you couldn't optimize your own serotonin synthesis.
But you mean that those people have those symptoms before they started taking meds, or this is a consequence of iatrogenic injury from SSRIs, for example?
Well, most of the time, so the reason someone gets put on a medication is because they were having symptoms.
Okay.
So the root cause of those symptoms is what we uncover. Now, sometimes the root cause could be other things. I'm just telling you, like, the most common that I see is that homocysteine elevated. Now, homocysteine can also be elevated, to your point, from stress, oxidative stress, and inflammation, and having issues which can be iatrogenic, meaning the medication is now causing harm to the person. It's causing adverse effects, which creates a process in the system that it is increasing oxidative stress. So it's a biological stress in the body that will impact a process called methylation, which does create excess homocysteine. So in that regards, yes, that can be true. And it is a marker I also see in those who are already injured and protracted injury, but I see a lot more in those patients. I see a lot more inflammatory markers in those patients. High sensitivity C-reactive protein, for example, is usually always sky high for them. And then also, oddly enough, vitamin D is often very low in those, more so than the people who come from the beginning. The people who are injured oftentimes have low vitamin D as a component to their and I don't know if it's a component of injury or if it's just something I'm finding
Pre-existing stuff.
on a pre-existing issue. Yeah, so it's hard to say, like, chicken or the egg, which came first. Was it the vitamin D deficiency that started it all, or did they end up in vitamin D deficiency because they're so sick, they're not going outside and getting sunlight, and they're not getting proper nutrition? So that could be part of the factor too with the protracted injury patients. But certainly homocysteine is a marker of a methylation byproduct, and so can be from a lot of other factors. But when I look at it and I see that elevated, I'll say, hey, have you ever been tested for MTHFR? Have you ever, we're fine, this is pretty high, and we want to see if this is a factor. If so, it changes the treatment trajectory, and what we have to do. So so then we'll go and do the genetic test. Now I like to do the genetic test first because it gives you the roadmap, the blueprint of what this person is genetically, prone to, and then seeing it in the labs, it's not a surprise. So if I see someone who has MTHFR or MTR, MTRR, those are other methylation genes, and high homocysteine, then I understand like
Hmm.
why. And I'm like, okay, now these genes are being impacted. This
Hmm.
is what we need to do. So it really helps solve a lot of the understanding the why, and then and then the how we fix the problem.
Okay. Well, that makes perfect sense, and it's funny because the way I work with my client, I have a little bit different approach. You start with gene test, and I start with dysbiosis to seeing
Yeah, the
how.
gut.
And
Hmm.
we met in one. We meet at one point because the deficiencies you mentioned, like folic acid, B12, and also D3 vitamin, they
Yep.
are also they people are also deficient in those vitamins when they have dysbiosis, because if you have dysbiosis in small intestines you cannot absorb those vitamins properly.
Absolutely,
So
absolutely. That is a factor, that is a factor,
yeah,
and you can see markers of that in labs. So,
yeah.
eosinophils will become elevated, basophils will become elevated, a marker called GGT. So you'll see some in just your labs, that you're doing, and then you'll see when I'm suspicious of dysbiosis just by looking at someone's labs is when I see a whole lot of nutrients on the low spectrum,
Hmm.
like on the low side, and then I see these elevations of inflammation, especially the eosinophils and the basophils and the CBC
Hmm.
differential. Then I start thinking, and then the chloride will be low on the low end, because of hypochlorhydria, which is you don't have enough acid in the gut in order to digest things, which is all a product of just what you're talking about, dysbiosis.
Yeah,
And there are people who are more prone to that as well, depending on there's several IL genes and those are interleukin genes, which make someone more susceptible to inflammation. And so dealing with gut health is so crucial for those people. So yeah, gut health is so important. And I'm glad you start there because the root of a lot of people's issues does start in the gut.
yeah.
I find that a lot.
Yeah, and they are very often disrupted because of exposure of antidepressants, antipsychotic, because serotonin is being produced in the
Oh,
gut and they disrupt the natural production. And
that's a good point. A
yeah,
lot of medications disrupt the microbiome
yeah,
in our gut and affect the way they react because serotonin, a lot of our serotonin is produced in the gut.
yeah,
And when you're now taking an SSRI, you're disrupting that process and those microbes that are used to producing that,
yeah,
then they stop producing and then they kind of shut down. And now we have a downstream effect of more quote unquote bad bacteria or gram negative and this whole dysbiotic picture that leads to inflammation because of the dysregulation that occurs due to that SSRI medication. Another medication that a lot of people don't know that I had to find out for myself that causes a lot of problems in the microbiome with absorption is oral birth control.
mhm. Oh, yeah, yeah.
And that is one that I
Never took
found.
it, but
Yeah, no, people think it's, a benign thing like, "Oh, just take oral birth control," or they're told, "Oh, you have a heavy period, you take oral birth control," and at a young age, as 16, 17, I was one of them, and I didn't think anything of it, and later on, I ended up with a lot of issues, and I found out through testing and trying to explore
so
what's wrong with me? Why am I having these problems?
uh,
And then found out that the oral birth control pill contributes to poor gut inflammation because of the issues that we're talking about with the microbiome and how it can disrupt that. But proton pump inhibitors will do the same
oh
thing.
yeah, yeah,
Things like Pepcid or Tums, a lot of people who are eating those or taking those regularly because they have poor digestion. That's a huge clue that you have dysbiosis and that you have problems with the gut. And you probably don't have high acid, you probably have low acid,
yeah,
which is what we find. And you don't need all those Tums and all of the reduction. You actually need digestion support, and you'll find you need enzymes to help break down your food so that you can feed the bacteria what it needs. So yeah, it's very there's a lot of nuances and overlap with a lot of our systems. We can't just look at our systems in a silo,
yeah. Hmm.
and say, oh, we're just going to look here or there, and when it comes to the gut, a lot of our systems are focused, actually start there, because of our enteric nervous system, the gut brain connection, number one, but also the immune system connection. And we have, through the lining of our gut, we have actual modulators of our immune system, because we ingest, things that could potentially harm us. So it makes sense that about 80% of our immune system lies within that interfacing, that lining of the gut. And if you have leaky gut, if you have dysbiosis, your immune system will then become compromised. And oftentimes people end up with autoimmune conditions because of their gut problems. So gut is a good place to start for sure. And then you got to look at it in the context of the whole picture as well.
That's I think, and another aspect would be mitochondria. It's also disrupted when you being exposed to psychiatric
Yeah,
medication.
toxin.
Yeah.
Yeah. And when you're exposed to things like lipopolysaccharide, which is a byproduct of the breakdown of the gram-negative bacteria. So as they die off and lyse, they produce this, the endotoxin,
They
which
release
is,
the toxins to the body because of the
yeah, and
iron.
it leaks out into, your GI system. This happens in all of us, this is a natural process. But when you have a lot of inflammation and you have now a leaky gut because of a high processed diet, high fat foods, LPS can seep into there, and now it's in the outer extracellular space where it's not supposed to be, and that sends alarms all throughout the body. So you'll see a lot of high inflammation markers if someone has a problem with LPS and leaky gut. It's a very common thing, but it affects the mitochondria because now we're creating a lot of oxidative stress, and we're creating a lot of demand on the cells, to combat this problem. And so over time, that's why people end up with burnout. They end up with poor fatty acid oxidation, and they can't eat. They just say, they're so fatigued,
Yeah.
because
SIBO,
now
yeah, methanol.
the mitochondrial's been disrupted, because of that whole process of added stress on the system, and detoxification becomes broken as well.
Yeah, that's another piece of the puzzle. It's not
Yeah.
easy to resolve those. Protracted withdrawal when you have so many things that are disrupted because of dysautonomia, and you have to, move from one condition to another, like from dysbiosis to mitochondria, from genetic test to,
Yeah,
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 it's
there's definitely a lot, when someone, and the thing about someone in protracted withdrawal, as Tomas, because you've had a personal experience with it, is that, it's so injurious on the person, it's so, depressing. It's so like it's such a downer that the person who's experiencing it has a hard time trying to like find the right tools, find the right things to guide them into the right treatment. And that's why it's important to get with someone who understands the process, like yourself. There's other coaches out there who do the same thing. But like, getting into that space, and understanding, like, once you're injured, you're not thinking clearly. You have a lot of inflammation going on. And unfortunately, you also end up going down a lot of rabbit holes that may not be necessary.
yeah,
And so focusing on one thing and systematically focusing on one thing at a time and having a gentle approach, I think is key, to what you and I both do.
yeah. On the one hand, you need to basically survive this protracted withdrawal. You have the personalization, the realization. You cannot basically, fulfill basic tasks. So how can you proceed with something more complex than going to a lab test and reading stuff and all this? Yeah,
Yeah,
it's very challenging to working with people in protracted withdrawal because you need to guide them like hand by hand, and
yeah,
uh, sometimes, yeah, it's challenging for me as well, like I'm still learning, and
yeah,
it's but once you see that they are improving, you feel, it's worth it, it was worth it.
Exactly.
And
Yeah. Yeah. Once you start seeing them turn the corner and you start seeing the changes, which are subtle at first, and then they, at first they don't see it, you see it, they don't see it.
yeah,
It's
yeah,
hard for them to see. Do you notice that too? Like you'll start noticing like, oh, you're looking a little different, but they still feel awful and they're not noticing
they
it. But
even feel sometimes offended. Oh, I know I'm still bad.
I'm
Like,
not better. Yeah, yeah,
yeah,
yeah,
yeah,
yeah.
yeah,
Exactly. Yeah, they get, well, I'm not better. When you tell them that you look better, oh no, and
yeah.
you start saying okay, and then the next time they come, like they have a calmer demeanor. They're not like so like tense or something, and you okay, and then they start noticing. Well, I think I'm having windows now. I think I'm experiencing a break, and then so usually the practitioner, or the people around the person starts seeing the changes first before the person with the injury starts noticing it
Exactly.
internally themselves and starts experiencing it. But it is very rewarding.
Yeah, it's rewarding in the end, but the process is very challenging. And I don't know if you also had that experience, but it's for me it's very sometimes it's very difficult to convince them to take anything, like because when they have bacteria overgrowth they do need to take antibiotics, and they are very traumatized, but being exposed to the meds previously, taking ssris for instance, they, no man, no way, I'm not gonna take any pills any more pills.
Yeah.
And it's like convincing them that, but it's still, it's still risky for them on the one hand, but on the other hand, if we succeed they do get benefits, and it's like trauma
Yeah.
response basically to
Exactly. Yeah. Yeah. The medications for SIBO, the rifaximin, I believe it's called, or
yeah,
Xifaxan. There's a
rifaximin
couple.
and for emo neomycin, yeah.
Yeah, and so those are necessary, especially if there's a significant amount of bacterial overgrowth.
Yeah,
But you can use oregano oil and things, and they can be sometimes as good as, but they um, they have to be used a lot longer,
yeah.
and you're still killing off a lot of bacteria in the process. Like just because it's natural doesn't mean there's no die off effect or no negative downside. There's still, and I think that's what people don't understand. Like whether you use an antimicrobial like herb or a
You have to
combination of
choose
herbs,
between either herbal approach or antibiotics, yeah.
or sometimes people will use both,
Yeah,
especially if there's a Clostridia bacteria, you use, vancomycin and Flagyl,
hmm,
metronidazole is, I think it's the
yeah, yeah,
generic for that one, and you go back and forth with those, because it's so hard to treat. But some people will also throw in the herbals or just start with the herbals, but it's definitely like a process, of using these, but they're tools in our toolbox. But just because you use the herbals versus the antibiotics, um, there's still side effects.
yeah.
So I don't want
The
people to.
die-off effect, especially.
Yeah, yeah, yeah. And so either way, either approach, there's risk. But the benefit of it is, if you have
Tremendous.
SIBO or even SIFO, which is the fungal overgrowth, which requires like nystatin, and then like a strain of Saccharomyces boulardii, which is a probiotic strain to help. Um, you do need those the medicinal ones are going to be, meaning the antibiotics, the antifungals are going to be more effective, oftentimes, than the herbals, and a shorter duration or shorter exposure. You can use the herbals, and I've done it before, but oftentimes you need them for a lot longer duration than you do the antibiotics, like the pharmaceutical
Yeah, for
one.
antibiotics like 2 weeks. For herbal stuff is like
Yeah.
5 weeks. I know, I know.
Yeah, versus months, like with the herbal compounds, it's months, usually a 3-month protocol.
Yeah,
You're doing things for months. You're doing, a
they are
die-off
less effective, to
month,
be honest.
replenishing, focus on, and then you go back and you do another die-off. It's like this whole process. So yeah, both processes, when you're dealing with things like that, you can get to the same end. But when you're using the pharmaceuticals in those cases, um, the exposure to the medicinal side of things, like the treatment is shorter, so the die off effect can be reduced. But, there's also, having to work through those symptoms and things like that of the side effects.
Yeah, but they like people in protracted withdrawal, they do crash from everything. Like sometimes they
Mm.
do have paradoxical reactions from even from magnesium. So it's
Yeah.
extremely
Mhm.
challenging. Like advising taking any drugs, like any supplements to them, and they,
Traumatic.
yeah,
Yeah, yeah, because they're very sensitive, and you can start, trying to do food-based approaches, like,
yeah,
for instance, eliminating sugar,
keto.
eliminating inflammatory food, to try to support the healing of the gut from a nutritional perspective. Um, but if there's a significant microbe in there that's causing, like in SIBO, causing an
You
infection,
need to
um,
eradicate for sure.
yeah, you do need it. Yeah, so there comes a point, because the result of leaving that go is endotoxemia,
Yeah,
which can put someone in shock, like, can put someone in the hospital, like seriously in like a septic shock because of the endotoxemia if you let that just go on and on and on. Colitis can develop, which is a very serious condition in the colon, where the colon becomes very inflamed, and now you're in the hospital getting IV antibiotics. And so yeah, so it's, when you see those types of things, you do have to treat them. You don't want to ignore them. But I understand the hesitancy that those in protracted withdrawal have because of the fact of, their injury. They are more sensitive
yeah,
to
they're like
treatment.
traumatized by the fact that they took meds in the first place, and they end up
Right.
yeah. So it's and yeah, but in the end, when they improve their symptoms, they notice that it was worth it. Not every
Yeah.
drug is the same like antidepressants for that matter. Yeah,
Mhm. Mhm.
I have another question. Just let me check. Um, okay, I think we talked already about uh, your genetic test, but because you already mentioned that you work with genetic testing, and can you maybe elaborate on that, like how these tests work and how can they be helpful for people struggling with? Uh, okay, maybe we already covered that up, uh, like how those genetic tests are helpful for people struggling with mental health issues. Uh,
Yeah, so genetic testing, the reason why I've switched to using that first as part of the model is because it helps give you the roadmap and
mhm,
understand why someone's labs are what they are and why they're not responding to certain treatments. So you basically skip a lot of guessing, because if you're just focusing on the lab data and trying to fix the lab data and this person's symptoms, of course,
mhm,
you're going by their symptoms and looking at their labs, and you're wondering why they're not responding to vitamin D like they should. They're not responding to the B vitamins like they should, or maybe they have a reaction to the B methyl Bs. That's often because of the genetics, the whole picture. So someone with MTHFR, a lot of times what providers will do, if they're just singularly testing MTHFR and ignoring COMT, they're
mhm.
only getting one piece of the picture, or ignoring MTR or MTRR. Um, they are ignoring a lot of pieces of the puzzle, and they'll say, oh, you need methylfolate, and they'll start them off with like 7.5 milligrams. That's a large dose of methylfolate, and the person will have a reaction, that they will have sensitivity, higher anxiety, insomnia. Oftentimes that's because you are over methylating a
Mhm.
cycle that feeds into the COMT, which is your catecholamine methyltransferase. If you then have met of COMT, meaning it's slowed down and it can't break down the catecholamines, you just backed it up because you increased the first part of the cycle and you did not optimize the second part.
Okay.
So and you wouldn't know that without looking at their genes. Looking at someone's genes, and if I see their COMT and they have MTHFR, I understand that I need to optimize MTHFR first,
Mhm.
then work on methylation and
Okay.
improving the first part of that cycle. And then I also know that homocysteine,
Yeah.
plays a role there. So depending on how high their homocysteine is, I may have to start with a little bit of the methyl Bs and maybe some TMG, trimethylglycine, to get that down before starting SAMe. Because someone with COMT would need a methyl donor. They need SAMe to help optimize that cycle. But you wouldn't give someone SAMe if their homocysteine is 10, because that's going to rev them up. That's why you'll see studies that use SAMe and they'll say, caution, this could cause hypomania. Well,
Yeah.
that's because that person has COMT met, and you just and their homocysteine was above 10. Yeah, if you give them SAMe, they're gonna become manic.
I'm glad you mentioned SAMe, because it's very common that people do crash from SAMe, since it's also serotonin agent, and it's very risky to,
Yeah, you want to only use SAMe if it's necessary in the genetic profile. That's why, yeah, not everybody does well with SAMe, like I just explained, if it's not used properly. And that's where the genetic profile gives you that roadmap. Also, for instance, someone who's low in vitamin D and you're giving them 10,000 IUs every day, and you retest them and their vitamin D is still low.
yeah,
And
it
you're
means
like,
that my
what's going
culture
on? And you ask them, are you taking it?
yeah,
Are you
same issues here.
taking it with food? You start asking them all these questions, like there's got to be something going on here. And they say, no, I take it with food. I take it just like you told me to. Here's my bottles, and then you realize there's a gene called the vitamin D receptor gene.
Yeah.
If someone has polymorphism in that gene, they can't absorb or synthesize vitamin D like you and I can. They actually do need a lot higher levels. So you'll see studies where people have used 50,000 IUs and you think that's crazy. Well, for certain people with VDR gene, it makes sense. They need those high levels, but that's not for everybody. I wouldn't give everybody 50,000 IUs of vitamin D every day. That's insane, So when you look at their genes, it makes a lot of sense. So starting there basically helps to shortcut the process. It helps me as a practitioner understand what works with you genetically. I can already tell where we're gonna run into problems based off your genes. HLA is another one. That's histamine sensitivity. So if
Very
someone has,
common among people with protracted withdrawal as well.
yeah, a lot of people have histamine sensitivity. So understanding what diets,
Of course.
are going to be helpful, but also understanding that if they have that and they have some CYP genes, which are the ways you break down food and your liver breaks down even supplements. Boy, you really have to be so cautious with how you approach them. These are the people that need drops of things. You need to start off with little drops, micro drops of things very slowly.
Yeah.
Maybe give them a DAO enzyme to help
To see how
block.
they react, to see if they don't crash any part.
Yeah. Yeah. And so, but the genetic profile helps you to see all that before it happens. Like, meaning the way I was doing it, just doing labs and saying, oh, you need vitamin D. Oh, you need, your homocysteine, you need methyl Bs and this, and I give you all of that stuff, but you're not responding well to those things. It's like, wait a minute, why are they not responding? I could blame it all on your protracted withdrawal and just say, oh, it's all your protracted withdrawal. Or I can have the blueprint and say,
Yeah.
oh, it makes a lot of sense. I see why you're responding this way because all of these genes. So that makes sense. We need to approach it this way instead.
This is, I think, is great approach to first see any underlying issues, like with this gene test you mentioned, or with the microbiome. And there is always a reason why you don't react to certain stuff in the way that we predict you're gonna react, and we need to find out why and then address it. Yeah,
Exactly.
I like it.
Absolutely. Yeah. Yeah. And there are ways to address different reactions depending on the reaction.
Yeah,
Finding out the why is definitely a piece of that puzzle. Like, why are they reacting? And of course, if you react to something, you want to stop, that supplement, that nutrient, if you're reacting to certain foods, because obviously gluten and dairy are the two
oh,
common, and though there
oh,
are genes
yeah,
related to that too.
oh,
There's genes related to lactose. There's genes related to gluten sensitivity that you can detect and say, oh, this person definitely is going to be prone to gluten or dairy sensitivities. So yeah, understanding that aspect of things as well can also help guide nutrient and nutrition recommendations, because not every diet is not always best for every person.
And sometimes they have a paradoxical reaction to foods after they hit protracted withdrawal. Before that, they were
Mhm.
fine with, they can tolerate they can tolerate like gluten and fiber, but not fiber, but dairy products.
Very,
But after discontinuation of the drugs, they starting having issues all of the sudden, and it's
yeah,
also something to that needs to be checked.
yeah, because epigenetically too,
Epigenetics shift, yeah,
the shifts of genes being turned on and off is very dependent on methylation,
yeah,
and your environment, like toxin exposure and things of that nature. So it makes sense when people are on medications that are damaging their microbiome, damaging their gut health, creating a lot of inflammation and oxidative stress, that a lot of these genes will now phenotypically, meaning now start showing up in the person's life when it didn't before, because they were maybe, more resilient. They were able to tolerate those things. But now that things are now turned on because they're under so much stress, and protracted withdrawal is
yeah,
such a huge stressor on the body.
the whole body.
And they now see, this impact, or the body sees it, this impact as, everything now that this person was potentially prone to is now basically flared up, and the person in protracted withdrawal is now suffering more, like you said, with reactions to things. They
Yeah,
can't tolerate dairy or gluten now. They maybe can't even tolerate, some people have a hard time even tolerating sunlight
yeah.
or light in their eyes. They're more sensitive to those
Physical
type.
activity like the dysautonomia pots, all this stuff.
Yeah. Oh, that's another one.
Yeah,
Mhm. Oh, yeah, absolutely. Blood pressure dysregulation.
blood pressure,
And
heart
things of
rate,
that.
everything is disrupted because of autonomic dysregulation.
Autonomic dysregulation, absolutely,
Yes.
100%. Yeah, and that throws a lot of, I guess you could say, wrenches in the whole process too.
Yeah,
Like when you're trying to go back and, like, quote unquote fix some of these things, it's like the whole dysautonomia that trumps everything. Like you've got to wait for the nervous system to settle down even before really getting into some of the
yeah.
stuff to try
I,
to
I I usually advise people to like wait at least few months when they quit the meds before we proceed with any interventions, because we need to see how you just basically are meds free, where we start from, and
Oh, yeah, yeah, because even, when you're off the meds too, you're not completely out of the woods,
yeah,
until you're as you might feel like, "Oh, I tapered off fine, I'm great," and then all of a sudden,
yeah,
the symptoms can creep up, especially if you might have done it too fast,
yeah,
and so you just have that's a good point, you do have to wait, see how your body responds to that medication being out of their system completely, and see also how they're reacting to the world,
yeah.
with now that their neuroreceptors are kind of like medication free,
Yeah.
and they're still, you have to think of them like
Sensitized.
baby neurons, and you know what I mean, like they're still in the healing state, so they're still going to be sensitive to things, and you got to know how this person is responding
Yeah,
to their environment.
yeah, that's for sure. It's a and
Mhm.
people they still want a quick fix. Like they want
Mm,
to. Is there any pill I can take to resolve this? And unfortunately, there
yeah.
isn't. Like
Yeah.
it's a long and challenging process, and it's. I wish I could sometime tell them take this and that, and you're gonna be fine, but it doesn't work that way. And
Yeah.
acceptance is the key here. That it's gonna take some time to regulate your whole body, because it's not the only nervous system. It's the whole.
Exactly. Yeah, yeah, it takes time, and, time is the one variable across the board
Yeah.
that is the common variable for everyone.
Underestimated for sure, because people don't believe in time itself, that I need to take something to resolve it. Sometimes, well,
Yeah.
sometimes it's good to address underlying issues like you do, like with the
Mhm.
genetic test, with all this stuff, but time itself is a healer as well, and don't.
Exactly, and if I have someone who's, that if I talk to someone who's severely protracted
Mhm.
withdrawal, I tell them we need to wait until things are a little more, because no matter what we do, we try to, I could potentially injure your nervous system more.
Yes,
And so we have to be very, very cautious in that approach. And so, oftentimes I'll say, let's wait until things start settling down with your nervous system, until you're able to at least get some sense of calm. And because a lot of times when people are in, as protracted withdrawal, especially acute in the beginning
When
stages,
they
when they
turning from acute to protract, yeah, they are.
yeah, when they get in that, they just don't. It's like the whole bottom fell out, and they are in such a state of paralysis,
Yeah.
and they are often very agitated. They don't know what to do with themselves, and
Mhm.
they react, unfortunately, to a lot of things.
Yeah.
And in that state, you have, I always, oh, we need to wait. We need to be, let's wait till this in time. And then we talk about supportive measures and things you can do. Some people respond to vagus nerve work,
Yeah.
some people don't, um, some people will
And sometimes
respond.
they don't know that they do respond because their response is so muted that
Yeah.
they need to, sometimes I tell them, like, you need to do this as a robot, like push it, fake it till you make it, because even
Yeah.
though you don't feel any improvements, they are still happening. Yeah.
Exactly. Yeah, that is a good point to make, because for me, I can do a vagus massage thing in a couple, and I can feel the benefits right away. I
Mhm.
don't have an injured nervous system, and the vagus nerve is being activated. Someone who's in protracted, their sympathetic is in so much overdrive that it's like the gas is all the way down, and then you're trying to tap on the brake.
Yeah.
Okay. But your car is still going to be flying.
Great
If
metaphor. Yeah.
Yeah. So it's like, so you're trying to tap on the brake and your car is not responding, but the brake is you're pushing on the brake, and then over time, eventually the tap becomes more of a push, and you start decelerate. You start being able to feel the response. So I do like that you say this, fake it till you make it. And it's not to be, because some people think of that term as like, oh, like, I
That's
don't
the point.
understand. Like, you know what I mean? Like they
I
think you're
know.
being rude or something, but it's not. It's actually scientific in the fact that at first your nervous system is so jacked
Yeah.
up here. It's not understanding what's happening when you're doing the vagus nerve stuff, the vagus nerve work.
Yeah.
It's like you're just gently tapping the brake and nothing is really happening because the pedal's to the metal and you're flying. But eventually there's a shift where now instead of tapping, you're pushing on the brake, and deceleration starts to happen, and you start to, the shift starts to occur. So it is a progression over time, just like neuroplasticity
Yeah.
is a progression
I'm
over
glad you
time.
mentioned that, because it's also involved, like it's a consequence of neuroplasticity to increase the BDNF. Even though you don't feel any high from the physical activity, it's still
Yeah.
happening. The neurogenesis is being triggered by all the brain-derived neurotropic factor. It's but
Yeah. Yeah. BDNF will increase with exercise,
yeah,
high endurance, strength training, different exercises. There are BDNF genes, by the way, that'll help you to understand what type of exercise you'd be better at, and that'll help, increase BDNF for you. But, um, but based off of just exercise alone and all the studies we have on exercise, the reason why it helps and it's been proven to treat depression
running therapy.
is because of the changes in the brain, and increasing BDNF as a main factor, and of course lowering inflammation,
Yeah,
all things you want to do if you're in an injury.
yeah.
So starting with these holistic things, though they take time and you don't notice them right away, which people, because they're in this space, they get so dark, and if
It's
they don't
difficult for them to
notice,
exercise at all sometimes, yeah, because of
yeah,
the dysautonomia and the issues with the autonomic, nervous system, the heart pressure and the heart rate, and this
yeah,
messed up. And sometimes they go offended when I advise them to do some exercises because they simply can't. And
yeah.
uh,
And even just as simple, I mean, if you can't exercise, you're having a hard time, just start with some
walk,
simple, arm, you don't have to have any weights, just doing this motion.
yeah,
If you can walk, get out and walk. If you're in your house, go, if you have
do five
stairs,
push-ups. That's
up and down the stairs, just you have to start somewhere, start slow, start with
move
movement.
your body, simply move your body.
Yeah, start with movement, because I understand the paralyzation, these people are so paralyzed,
Yeah.
and they're stuck.
Or
They're
agitated
in
all
bed.
the time. Yeah.
What's that?
Or agitated when they,
Yeah,
yeah.
yeah,
On
yeah.
the
So,
other hand, they are agitated.
extreme, you're frozen or you're right. So
Yeah.
you're one extreme of
You're
the
never relaxed, but you either muted or agitated or
yeah, yeah. You're either frozen or you're in fight or
yeah,
flight. You know what I mean? So
like
fight,
that.
flight, freeze. So it's one of those. And if you're frozen, it's hard when someone says exercise. What? If you're agitated and you're pacing because you have akathisia, it might be, the concept of exercise may come more easily to, okay, I'll just walk this energy off, or I'll do jumping jacks to kind of,
Yeah.
get this energy out, those types of things. But really, the exercise at first isn't going to help the symptom, but it's helping the brain.
Yeah.
And then,
It's a
because
still signal, even though you don't feel it. Like it still sends a signal to your brain that to increase to release the whole cascade of neuroplasticity of
yeah,
neurogenesis,
neuroplasticity, circulation, reduce inflammation, all of that
all of that.
happens. So yeah, so I know it's hard when someone's in protracted withdrawal to listen to these types of suggestions and even
Yeah.
conceptualize trying to do them, but the importance of them, it can't be underscored enough, and it's all about consistency over time.
Yeah.
And when I say over time, I'm not talking about in a week or two. Like, these things take
Year.
months, if not years, for some people, to start to really get that traction and get that
But
benefit.
But when
And
they hear that
that,
it's gonna take like maybe even few years, they are totally terrified. That like how can I survive next 3 years having 24/7 suicidal thought? And it's like I'm hesitating if I should tell them like the how it's gonna take, because how long it's gonna take to resolve. But what I sometimes having a diary is helpful to track your symptoms in the process. I
yeah,
also recommend this because to have a
ab-
some kind of starting point, that I started with like 10 out of 10 and now I'm like 8 out of 10.
yeah, no, that's really good. Symptom diaries, tracking your symptoms is important because it's objective. And if you're in a place where you can't do it because you're so protracted, having
Yeah,
someone else
someone else
to
support
help
of your
track
friends.
it for you at first until you're able to take it over. But it really helps to see, because like we were talking about earlier, sometimes we start seeing it first, right?
Yeah, like you
'Cause
said.
they don't see it. You can tell them, go back to your tracker and see how your symptoms were in the beginning, and they'll say, oh, they were all 10 plus plus plus, they'll have all the, and then you'll say, oh well, and now it's an 8. That's improvement. That those two, I know it's not a lot, but it's improvement, and we're going in the right direction. So just kind of, it helps you to see the progress you're making, when the progress that you're making may be even just a little bit, even if it's taking the edge off,
Yeah.
it's progress. And even if it's just taking the edge off for a period of time, it's progress.
And yeah, and reassurance and confirmation that you will recover. This is not permanent condition, you will get better. And sometimes I have to every single day remind my clients that it's not permanent. They ask me on WhatsApp like I'm not improving anyway, and they when we have sessions they say, oh, thank you for all the reassurance, because it pushed me through this experience. And
Yeah, yeah, because exactly, that it's not permanent, and when you start thinking it's permanent, you lose hope.
you lose hope, and when you lose hope, you
Yeah, and the thing about hope is that hope is a driving force. It's what's going to get you to the other side, and there's so much hope on the other side. And you have seen this because you've gone through it. You were a different person before you took the
I was
medication,
taking hope from others. I was pessimistic, dooming, but it was
while you were in the contracted, right? You were
yeah,
pessimistic, you were all these things that were out of your character.
yeah.
When you came out of it and you realized, oh no, like I was telling the wrong thing, like because you thought it was permanent, like you were
It
stuck in
feels
it. You
like
were like those people. You were like, you were telling everyone, no, no, this doesn't go away. This is permanent, because you had a very long journey of it, right? So you thought that that's what it
there
was.
was no way that somebody could convince me that it's not true, that I was.
Yeah.
And this is like facing a wall, like to trying to convince people in like severe protracted that it's gonna improve. So
Yeah, it's hard. It's hard for them to see that. But understanding like stories like yours and Angie's and Chris Page and Nicole Lamberson and like all these people that have gone through like this crazy like years of injury, like I mean, unbearable pain, that you went through, and then seeing the other side of it now, it's like a transformation. And it's not to glorify it or anything, but it is something that awaits on the other side. There is hope on the other side. And oftentimes going through a process like this pushes you to be something that you never thought you would ever be
yeah,
in the end. You have a new purpose in life.
yeah,
You have a new drive in life. You have a new reason for living. I mean, look, I bet you never thought as a neuroscientist that this is where you would end up helping people through protracted withdrawal,
yeah.
you know? Um, and here you are. It's like it changed your purpose in life. And
Well,
now you're dedicating your life to helping others, which is amazing. And so that is something that I think is a good place to leave people with, is that there's hope. During this time is the common denominator through all of this. Working with someone who can help guide you through this process, who's been through it before, I think is so important.
yeah.
And knowing that there is an end to this, that is where the hope lies.
But sometimes I think you also need to take extra steps, like the work you're doing with the gene test and addressing the
Mhm.
underlying stuff. It's also very important in the healing process that can boost the healing process and shorten the time that you're gonna suffer. And I strongly
Yeah.
believe that if I started earlier, like if somebody guided me through this and pushed me through this, the worst part of it, like when I was, let's say, 2 years of the meds or 3 years of the meds, it would be not as long as it was. So I think that addressing this like you do
Mhm.
with your clients, or I'm trying to do with my clients, is also very beneficial for those that and also you need to have something that you fixated about. Like you cannot fixate
Yeah.
about your symptoms. You need to keep going with things that put your mind at ease, and to keep your mind busy with stuff that
Yeah,
potentially gonna
that's a good point.
improve.
Yeah, fixating on positive things and things of gratitude, things to be grateful for. Maybe, once this is over, focusing on a goal that you have, like maybe you want to take that trip, envision yourself
Yeah.
in Europe, or, if you want to go, if you're in Europe and you want to go to the US, everybody in the US wants to go to Europe. Everybody in the Europe wants to go to US.
Yeah, right. And I have another question regarding US, but because there's currently a crisis of psychiatric drug overuse in US, right? And in
Oh,
your
yeah.
opinion, what should replace the pharmacological approach?
In my opinion, my philosophy is the skills before pills
I
approach.
know.
So working on those skills, meaning when you have symptoms right now in the US, you're so right, Tomas. It's awful, but we have a lot of advertising. When it comes to the United States and the overprescription of these medications, the reason why a lot of us feel like we have to have this label, or we have to go to get medication, is because advertisement is legal for pharmaceutical companies in the United States,
Yeah.
and it's not in many other countries. So pharmaceutical companies have a lot of dollars,
Mhm.
and so a lot of the advertising dollars are going on these big networks. So, and then of course they're influencing policies and lobbying for different policies. Well, the government we have in place now is working against the pharmaceutical industry, and taking a lot of heat for doing so. But I think we're on the right track, because our minds right now are so programmed to, oh, I have depression, or I'm not feeling down, or people around you oh, you
You
look
have
like you're not
chemical
feeling
imbalance.
well, or you go, guess what, you go to your doctor, they give you an antidepressant,
Yeah.
when maybe you really just needed to get some more sun. Maybe you just needed to start exercising.
Yeah.
Maybe you needed to change your diet. maybe, you know, and
But people don't like to hear this. Like when you take overdose, they say,
no,
"Oh no,
no.
I need to take drugs to restore my imbalance."
Because this is why. This is and I've mentioned this on my channel before during a couple lives that I've done where people, you know, I talk about all of these skill building things and all these things you can do to support your mental health, and everyone wants to know about the pill. You know, and then they say, well, why don't, when I go to the doctors, they don't talk about this? Well, it's because if we're honest with each other, because our society has been cultured into believing that there's a quick fix called this happy pill, and we take this and it'll make us feel better, it's a shortcut. If I don't have to change my diet and I don't have to exercise and all I have to do is take this pill and I'm going to feel great, I'm going to take the pill.
Well,
What you don't realize is your shortcut, the shortcut you're taking now to feel better is actually going to affect you and impact you down the road,
what
whether
if
it's
you-
a couple years for some people, a couple years they start noticing some problems, whether it's 10 years from now or 20 years from now, there is a point where the medications stop working. You start going through a whole cascade of, oh, well, we need to now add this antipsychotic, and now we have to add a benzodiazepine, and now we have to do this, and now you're treatment resistant, and now you're getting ECT, and now it's sickening. It's
yeah,
maddening that that is how our society
and
progresses through mental health treatment.
yeah,
That is the norm.
yeah,
And instead of going for that pill, I would strongly advise that you start looking at root causes,
yeah.
your genetics, your labs, your lifestyle, your nutrition, your gut health, you know, your biology, like what is going on.
Some traumas like from the past, like
Oh,
the way you
trauma,
were
so
raised.
huge. Trauma is often an epigenetic trigger.
Yeah,
So trauma creates a cascade of inflammation in the body, and there has been shown that trauma, if you look at studies on ACE scores, adverse childhood events,
yeah,
and people with chronic disease, you'll find that people with chronic like diseases like diabetes, heart disease,
yeah.
their ACE scores are pretty high. So their exposure to childhood adverse events, which are traumas, okay, actually cause in the long term chronic disease because of the inflammation and the epigenetic factors that happen when someone is traumatized, what happens in their brain and how their body and their DNA responds to that. So that in and of itself is a huge factor, and there are actually genes that will show if you're more prone to having an issue with PTSD from a traumatic event.
No.
Some people are more resilient than others, right? Not everybody who experiences a traumatic event ends up with PTSD. Why is that? Well, it lies in your genes. And so that's another factor. But definitely exploring those things. Sometimes people have anxiety because they have low self esteem.
Yeah, but don't you
And
think that sometimes it's like a behavioral pattern that the way you were
yes,
raised by your parents, they implemented some reactions to certain things in your life, and it's nothing to
that's
be treated.
such a good point. A lot of times it is like it's a learned behavior.
Yeah,
You know, your mom screams because she sees a bug,
yeah,
you scream because you see
yeah,
a bug.
yeah. Of
You know,
course,
someone else who was raised to like
mirror
take that
neurons,
bug and put him in the hand and let him outside, they don't scream that, "Oh, it's a bug. Okay, go outside. Bye-bye,
and
bug," you know,
then
or
you
whatever.
react differently because this is the
That's
most
what they
important.
learn. They learn that from their parents and how they were raised, that that bug isn't really bad, it just needs to go outside versus the, you know, the mom who screams and
If you,
jumps and yells, and then the child learns, "Oh, I gotta scream, jump, and yell
yeah,
because of the bug." But a child, if they didn't have that as
they
a
replicate the
curious
behavior
in
from their
nature,
parents.
yeah, they wouldn't scream at a bug. They would be curious and maybe play with the bug or want to know, you know what I mean? Or
Yeah,
hold the bug. So yeah, you're so right about things that we see in our environment and what we are conditioned to
yeah,
do. So a lot of this is conditioning, just like we're conditioned by, you know, these subliminal messages from pharmaceutical companies.
yeah,
Take this pill. You
Yeah.
feel better and you see the person like, in the woods or in the fields and dancing or whatever, and I want to take that pill. I'm going to feel great, it's going to be bliss. And you don't realize, oh, you're setting yourself up for an injury down the road, most likely.
And unfortunately, psychiatry is based on false narrative. This is
A false narrative. Yeah, unfortunately, the more that I'm in this space,
mhm.
it saddens me that there is a false narrative out there.
Yeah.
Now, I don't want to discount people who have depression, who have problems with anxiety. These symptoms are real. So
Yeah.
I never want to discount people and say that,
Symptoms are real, but the root cause isn't in your chemical imbalance, and there's no
right,
quick fix
right.
for.
I think that's the point. Your issue is not a Prozac deficiency.
Yeah,
Your issue is multifaceted.
yeah,
There are so many components to make you, it's individual for each person. And for us to think that we can take these chemicals, these synthetic chemicals, and alter
facts.
someone's brain chemistry and make them quote unquote better and heal their mental health problems is very arrogant and misleading,
Yeah,
because we still don't understand how the brain works completely.
yeah,
You're a neuroscientist, you know this. There are so many areas of the brain that we still have yet to
yeah.
uncover and understand and realize. And
Interfering your
so,
fragile nervous system with psychoactives for like 5 years. It's like when I sobered up from the mess, I realized what the fuck I was doing. Like why?
yeah,
And because I believed in my that my doctors, if my doctor says so, that it must be true. Well,
yeah. And unfortunately, that's the narrative being taught in the school. So that's what they know. So I don't want to push blame on the doctors, the psychiatrists, but soon they're not going to have an excuse, because we
yeah,
are starting to push the narrative. We have research articles out now. We have a book, the Maudsley De-prescribing Guide. We
yeah.
have shown a light into this topic where it cannot be ignored. So eventually, the new generation of providers coming out, the new
Or
generation of
prescribing
doctors
instead
coming
of
out,
prescribing. Yeah,
are going to be right deep, not only deep prescribing, but now stopping to prescribe, no
yeah.
longer prescribing these medications unless there's like a dire emergency, like for instance, benzos and status epilepticus, kind of a situation where you're having seizure after seizure after seizure. I mean, I'm going to give that person injection of IV Ativan, lorazepam, because that's going to save their life. But aside from things of that nature, really honing in on therapeutic modalities, getting to the root of what triggered a lot of these symptoms. Is it poor self-esteem? Is it trauma? Is it family relations? There's a whole therapy called interfamily systems, and it talks about different parts and how they interact with each other. And then just dealing with, as far as other therapies like emotional regulation. Maybe you never learned how to control your emotions or handle
Open
big emotions.
dialogue therapy, for instance.
Yeah, yeah, biofeedback and
Biofeedback.
things like that. There are so many therapeutic options out there that work, that have evidence that they work. It's just because we are so prone to the quick fix, the solutions, because of this thing, our
Yeah,
phone, right?
yeah,
We can come here and ask it a question and we get a response just
yeah,
like that, right? I mean, we are programmed for the quick fix.
yeah.
So we need to start to reprogram ourselves and start asking ourselves, like, doing the hard work in the beginning, and what you need to do to figure out all of this and why you're in the state that you're in the long is going to produce much more fruit in the long run. Your quality of life is going to be so much better in the long run, versus going through the cascade of pill after
Quick
pill
fixes
after
and
pill after pill. It's like they're just throwing darts, man, at a wall, trying to figure out which pill's going to work,
and
and
then
how
the
which
symptoms arise and
combination.
you get another prescription and you polydrugged in a minute. Yeah, and
Yeah, I mean, kids are being polydrug left and right. I see it all the time. It just boggles my mind of even how parents are being programmed to medicate their kids, giving them psychotropic drugs and multiple drugs, to subdue
and they
and
think it's okay.
suppress
Like
their
now we have
emotions.
ADHD crisis, like to prescribing methylphenidate, like amphetamines derivant to efficient. attention disorders because they overuse mobile phones and stuff. And
Oh,
it's a
yeah,
great market, you
absolutely.
know.
Yeah,
But
yeah, there's an epidemic of ADHD, right, because everyone thinks they have ADHD because they're so programmed for the quick, what is that?
quick,
TikTok, 30-second reels going boom, 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 boom.
yeah,
That's what our attention span has been reduced to.
yeah.
And it's insane, that we've gone from a society that really valued family time and reading,
Not
like
endless
actually
scrolling.
reading, like actual books and
Yeah,
things, and to everything on the phone.
yeah.
I mean, even communication between family members is all on the
Yeah,
phone.
you're looking at the phone
Text
instead of
and
having
yeah, instead of, like, going
meaningful
to someone's
conversation.
house and having an interaction with them.
Yeah,
Yeah, so it's definitely problematic in our society. I know it's more so in the Western culture, and the United States is always in the news in regards to these types of things, because we're such a fast-paced culture, and we're driven, to see results, results, results. We're a results-driven culture,
yeah.
and that's where I think the pressure lies for people to go to the pill. But unfortunately, it's to their detriment, and they'll figure it out later on that the
To
medication
increase cognition, to increase to decrease anxiety, to cope in work, but we are
yeah.
overstimulated and we want to compensate with drugs, and
Yeah.
in the long
If you
run,
look at
it's
other societies like in Japan and that really value the family time and having cleaner diets, cleaner food, even just looking, into these cultures in India, where there's a lot of poverty there. The mental health statistics are so much less than they are here in the United States, and it has to do with multiple factors. They value family, they value connections, they value clean food, no processed foods. Our country is one of the few that allows a lot of these chemicals in foods that we have. And so I think that's going to change. We're starting to change that narrative as well.
I think.
But still, it's like, when you start looking at why, cultures like Greece, there's a lot of blue zones in areas of Greece. Blue zones are like areas where you have a lot of people who age into the hundreds, like hundreds and 10. You'll see a lot of people that are old in those regions, is because they walk up and down, they walk from their home into the village, and they walk back, and they have to walk up these steep terrains to get to their home in the mountains, and it's just how they live, it's how what they've been doing all their life. They grow their own crops, a lot of them do. They eat very clean, they eat from the earth, they don't eat things from boxes and containers and cans and those kinds of things. So when you start looking at the cultures in these quote unquote blue zones of people having longevity, you start realizing that they value the slow paced life.
And they
There's no
enjoy my
pressure.
life much more than people with, we have everything, but we don't enjoy anything.
Exactly. Yeah, there's always a pressure to do more, do more, do more, do more, instead of like, wait, we need to like, so,
Settle down.
like enjoy where we're at. And that's the whole premise behind mindfulness, mindfulness meditation and being present in the moment. And because we are so driven, we're this society that's so driven for like the next mark, the next thing, reach your next goal, like do your next thing. And I'm not saying it's not a good thing to be, successful and to have goals, but we have to also in context like take time for ourselves to like enjoy where we're at and enjoy the process and the journey that we're going through. Otherwise you miss the whole mark. There's always going to be another mark, there's always going to be another thing. And so I think that's part of our societal uh, change that has to happen in our country in order for us to stop depending on drugs and pharmaceuticals to get better, is that we have to start changing our focus from society, successfully driven and fast-paced driven and results driven, to more family driven, to more connection driven, to more like slow-paced living, and being grateful for where we are right now. I mean, as a country, we should be very grateful in the United States for the freedoms we have that other countries don't have. And
Yeah.
I think we miss that mark a lot because we're looking for the next best thing.
Yeah. Yeah. Well said. I mean, yeah. And overstimulating nervous system like has tremendous consequences in those
Hmm.
days. But and what bothers me is that even though the chemical imbalance theory has been debunked like a few years ago,
Hmm.
it's still up there. In US, there are still advertisements for those drugs, and chemical imbalance theory is running wild. Even though the scientific world, the medical field already knows that it's a basically scam, but it's still there.
Right. The majority of people, right, don't have a serotonin imbalance.
Yeah, and
Yeah.
it's gonna take many years for this market to collapse because it's multi-billionaire billion-dollar.
Yeah, it's driven by pharmaceutical money. And like I said before, the pharmaceutical industry has billions and billions of dollars and advertising dollars that they're throwing, to our into our society. And so, because of that, getting rid of, pharmaceutical advertising is the first step, but a lot of the companies that rely on pharmaceutical advertising, like these big networks, will collapse
Mhm.
if they don't have a plan B. So that's why there's a big push here, and it's a very um a topic that is most Americans will understand, like, yeah, advertising for drugs is not a good thing. And a lot of Americans are starting to see and understand, like, that drugs aren't the answer, all the time. There are certain drugs that save lives. So I don't want to, like,
Yeah,
use
it's
all medications and all drugs, just to be clear. But because the pharmaceutical industry has their hands not only in advertising but in our educational systems, and how they basically paint the narrative at universities, and they donate substantially, in our education systems, universities, and as also, um, for politicians. There's a lot of political pool that they have, and they invest a lot of their money into politicians to get their agendas across. So that, as a system, needs to be addressed. So we can get rid of their advertising dollars. That's a good start. But all of these other means that they have, they're going to find another way to control the narrative.
yeah.
Whether that's now putting that funding from advertising more into our education or more into politics, who knows? But I think we're on the right track. It's just a lot more needs to be done,
Hmm.
than just removing the advertising dollars.
Yeah, that's for sure. It's gonna take time, and spreading awareness and educating people is the best way to go for now. I think, like,
Absolutely. Yeah, absolutely. Education is key. It's one of the things that, our channels are dedicated to. So I think that's great that you have your channel, and helping people understand protracted withdrawal. I think it's wonderful, sharing your story, sharing the harms, that have
how to
happened
cope.
because of
Yeah,
these drugs, so people get it. That's step one, us kind of getting the information out there. And then, the movements that are happening as a result of the education is also key. Like, there's a petition, here in Florida to get red dye out of, the food supply,
Mhm.
so that'll be great.
Oh yeah.
There's a conformed consent,
Oh yeah.
thing, making sure that doctors are giving informed consent before prescribing SSRIs. They have to tell them about iatrogenic effects. They have to tell them
Yeah.
about protracted withdrawal. They have to tell them about
PSSD.
PSSD. They have to tell them about all these things. Like, these are things that can happen to you. They have to sign a form stating that they understand that these are potential risks. And I think that will also help to shift the narrative. Once people realize, oh, when you say risk versus benefit, the risk is I could have PSSD,
I cannot
you
feel
know,
orgasm for the next 10 years. So
yeah, oh, wow, I never mind, I don't wanna sign up for that,
yeah,
or, oh, I can have protracted withdrawal, an injury that could take
yeah.
years to
To
heal. No,
resolve.
thank
Yeah,
you. So you'll have less people signing up for it.
yeah. But how come uh, these days, like when I remember when I had my first appointment with, in psychiatrist's office, he told me not to read, don't read a leaflet because it you get scared, and don't read it because it's very uncommon to have these side effects, and just don't bother. The and that was the narrative, and I think it's still there. I mean, the appointments last around like 15 minutes, and
Yeah,
yeah,
yeah, the
it's like,
appointment times are short, depending on what type of, like here in the US, a lot of insurance models, they have to have shorter appointments in order to make any type of profit. It's a business, and insurance only pays so
speed
much.
running patients. Yeah.
And they exactly, and insurance actually really for to the detriment of society. The way our insurance model works here in the US is that they actually provide funding. They make it so that providers have to see so many patients, so they make the model like you have 15-minute visits, you see so many patients, you get so much. You know what I mean? So they make it a numbers game, and
I know. What about
they incentivize providers to have these fast, quick visits, because the longer visits are not much
profitable?
more than a 15-minute visit when you look at it in that regard. So they're not paying you. So if you can get
It's better to
three,
have 4 visits in 1 hour than 2 visits in 1 hour. That's obvious.
right, if you can get 4 visits in 1 hour, exactly, versus two, and those two are not going to equate to the four, what are you going to choose?
Yeah, of
You
course.
know what I'm saying? Like, so they incentivize the quicker visits. They incentivize those codes so that providers are seeing more patients, and it leads to provider burnout. It's a whole broken system. And so how can someone really get to know you in that amount of time? Now, they will oftentimes, in not so much in the primary care office, but in a psychiatry mental health office, if you're in a decent practice, they'll make it 30 minutes or 40 minutes. Like, you know what I mean? They'll stretch it out for the initial, but even that's not enough time.
Yeah,
You want to at least get 60-90 minute initial appointment, to really understand and make sure that you're giving them a lot of, like, what I like to do is I send a lot of forms beforehand so I can gather a lot of information, a lot of
yeah,
questionnaires. So that helps me understand and guide my questioning, so that we utilize the time so that I get to understand what the problems are at a
yeah,
deeper level. So making sure that that's part of the process, and it's not just 15 minutes, tell me all your symptoms. Oh, okay, boom, you check all these boxes off in the DSM. They use this
yeah.
book, the DSM, you check all the boxes, and that, okay, so you meet this criteria, you have major
Yeah,
depressive disorder, boom, let's give you this SSRI.
yeah.
I
Your
mean, that.
criteria meets the SSRI prescription, and
Yeah,
good to
yeah, it's just
go.
like, and that's unfortunately what a lot of providers are doing, because they're forced to do it, is they just kind of go through symptom checklists and say, "Oh, okay, you meet the
Oh,
criteria for this," and they're not really digging into
yeah,
the root cause, the why, the how, and all of those things.
yeah. Yeah, we have similar crisis in Poland. Like uh, medical practitioners, they do speed run their appointments, and
Mhm.
same here. I mean, maybe on different level, but still the same. Like it's not easy to find someone who's dedicated to this work and really wants to help you, instead of speed running the business. And
Yeah, yeah.
I I have a last question for you, because as you said, your slogan is skills before pills. And what kind
Mhm.
of skills do you believe people should develop before turning to psychiatric medication?
Yeah, so the skills, the foundational ones, are gonna be emotional regulation,
Mhm.
and learning how to handle strong emotions and learn how to handle stress.
Mhm.
Those are huge. I do a lot of teaching on vagus nerve work. Love work on the vagus nerve because
Oh,
it helps with nervous system regulation and helping
can
to.
you tell more about it? Because I'm curious. Like, do you see that it benefits you in the long run, the vagus nerve stimulation? Like, because I know that there
Yeah.
are devices
So
to stimulate vagus nerve. You can do this on your own, but I thought that it was only temporary, like quick fix if you want to, feel sleepy and all this stuff. But I never heard about
yeah, so it is something I do right every single day.
like yourself.
I do. So I have a couple of things that I do every single day. In the shower, every single day when I wash my face, I go through a process of stimulating my vagus nerve here, by my ears
Mm-hmm.
and behind my neck.
Okay.
And this kind of helps me to set the tone for the day so I can be in a state of relaxation. Throughout the day, as I'm in tune with my own nervous system. And these are things I have to do. I learned because of the way I'm programmed genetically. I have some of these mutations which make me more prone to stress.
Mm-hmm.
So I've learned how to manage it without medication by using these tools, and vagus nerve is definitely one of them. So if I'm working a lot and I'm starting to feel some of my triggers, which are I start to clench my jaw, my neck starts to get tight, and I get like this. I know I need to take a little break and I need to go back and do the vagus nerve
Okay.
massage. While I'm doing it, I have my eyes closed. So I'm using a couple of things. So it's not just the vagus nerve, it's also mindfulness because I close my eyes and I'm feeling, so it's grounding because I'm starting to feel the sensations, how they feel around my face, how they feel around my ears, how I start to feel the tingling sensation. I just start to notice that and I'll tell myself, you are calm, you are safe. You are safe, you are calm. And I'll just keep going through that. So that way my nervous system calms down because when I start getting like that, I start to think that fight or flight system is about to take off.
Mm-hmm.
Like I'm not safe. So it's about understanding your triggers, knowing what they are, knowing your warning signs, and then using skills like, for me, the vagus nerve work. Grounding work can be helpful. Placing your feet, there's grounding mats. Just taking your socks off and just putting them on, like if you have wooden floors or whatever floors, and feeling the floor beneath you, feeling yourself in where you are in your chair, like just like kind of getting yourself, using your senses, seeing what's around you. If you notice a certain smell, what kind of taste you have in your mouth, like just
Like
kind of using
mindfulness. Yeah.
what's that?
Mindfulness to be aware of
Yeah,
what's
these are
around us.
all tools for mindfulness and different grounding techniques. So yeah, using things like that, breathing is also another way to stimulate vagus nerve, by diaphragmatic breathing and exhaling longer than you inhale. That will stimulate a vagus nerve response, which will help to lower your heart rate and help to create a sense of calm. Now, when you're in a protracted state, this is hard to realize because you may not feel it at all. You may not feel like it's working. What's she talking about? I'm doing this stuff. I don't feel
Yeah, of course.
it's helping. But over time, like I mentioned earlier, there are gains that you get over time, and the things are
Even
happening
though you don't feel like it, it's
level,
still you're
and
still
it's been proven.
yeah.
There's also stimulation devices. I do use a device called NeuroSim at night. It's one that you clip to your ear. There's another one called AlphaStim that clips to both ears.
Mm-hmm.
That stimulates not just vagus nerve, it's a cranial nerve stimulation. So it's stimulating all the cranial nerves in different frequencies. It's a little bit stronger. For protracted people, I would advise just like a very gentle approach, like NeuroSim, because it's just one. It's directly on the ear, and it's actually going to hit the vagus nerve more directly and not affect the other nerves. So it has less reaction for something called derealization or depersonalization, which can happen to people when they use these devices, especially the ones that are cranial nerve stimulation devices, because they're affecting all the different cranial nerves. Like you can, if you're in a protracted withdrawal, be very sensitive to that and get like like a type of depersonalization or derealization experience, which can be scary.
They
So
already have the personalization and the realization. So
yeah, yeah, and it can get, yeah, and so it could certainly exacerbate that. I've seen that happen. That was some of the, I guess you could call early on mistakes that I made in my practice when I was using vagus nerve stimulation. When I learned,
yeah,
if it's just a straight anxiety or even insomnia,
yeah.
those devices can be very, very helpful. To help someone without an injury, as opposed to, so this is like a skill, like it's more of a technology than it is a skill, but it's taking the skill of vagus nerve massage that you can do on yourself to the next level.
Oh,
and using and implementing these technologies and devices. But yeah, journaling is a good skill.
yeah,
Prayer and meditation are good skills.
yeah,
Um, and of course, then looking at lifestyle things, I consider those skills too. Nutrition,
yeah,
getting into the habit of eating healthy, eating well, lowering your inflammation burden, getting fresh air outside, getting sunlight,
yeah,
sleep hygiene. Those are all skills that you can use to really optimize your mental health overall.
yeah. These are the basics that everyone should do on
The
daily basis.
basics.
But
Yeah, but unfortunately, not everybody does
yeah,
them.
yeah, and,
Mhm.
yeah. And it's easier to monetize on selling drugs than saying go for a jogging. But
Right, that's
yeah,
why a lot of people choose the drug, prescription drug versus the skills, because the skills
it
take
requires some,
time.
you know,
It requires work,
work and
it requires work, and so when something requires work, oftentimes people shy away from that, and it requires a lot of reflection
yeah,
on you.
work,
Why are you
reflection,
turning
education.
to these certain things for the fix? It puts the focus on you and how you're coping, and it's oftentimes also reminds me of people who go to addictions, which also there's genetic propensities for that, but they'll go to using a drug for the fix versus fixing the
To
problem.
numb the emotions, to yeah, and they don't
Exactly.
learn to how
Instead
to
of
deal with
dealing with the
emotions.
emotion and fixing it because it's the quick fix and they get it, so it's the same kind of principle. We're just more programmed for the prescription drugs, but the same principle applies for people who are addicted, going to marijuana or
Yeah.
cocaine or heroin or these other drugs out there. Even caffeine is a drug, really.
Yeah,
If
of
you're
course, and
turning to like all of these things as a solution, you have to start questioning why are you turning to that as your coping
you can
mechanism?
choose the good coping and the bad coping. Like you can,
Exactly.
when your
Exactly.
job is done, you can go to for a brisk walk and you can have a drink, and it's up to you.
Right. Yeah, and
You are the
alcohol,
one
yeah,
who's
that's a
responsible.
that's a big problem in the US, and I'm sure
Oh, in
across the
Poland as
world.
well. Trust
Yeah, yeah, yeah,
me. We're
yeah.
worldwide known from
For
for
vodka, yeah, right? You guys, yeah, drink a
vodka
lot
and
of vodka.
all this stuff. But
Yeah, so you gotta be careful, when you start turning to the alcohol for the
yeah,
solution, and that's messing up your receptors and causing brain
but
inflammation.
the same applies to SSRIs and other drugs. They are just different
Yep.
form of drugs. They have like they work for different ways. But on the other hand, if you withdraw from alcohol, it takes a few weeks to put you
Yeah.
back together. But with protracted withdrawal, it's a different story.
Yeah.
But yeah, yeah, it was very informative podcast. I'm very glad that we met once again, and thank you for joining me in this in this podcast. And yeah, uh,
Absolutely. Thank you so much for having me, Tomas. I'm glad to be here and glad to share, what I do for, to your audience, and hopefully they gain some insights on what they can do to help their mental health.
yeah, I'm gonna link your website so everyone can check your services with your gene analysis and genes analysis, and hopefully somebody can benefit from you,
Thank
like
you.
I did during this podcast. Yeah,
Of course. Thank you.
thank you.